Hi, I'm Troy Otan. This is Factors Affecting Physiologic Function. Before we can discuss the factors affecting physiologic function, we need to understand what these functions are. World Book defines physiological as having to do with physiology, which encompasses all of the functions of all living things. The scope of this presentation will focus on the functions of the respiratory, circulatory, and energy-producing systems. These systems work synergistically to achieve optimal performance. The respiratory system takes up oxygen to be used and expels waste products that are created during energy production. The oxygen, waste, and nutrients are transported via the circulatory system. When any one of these systems' functioning is disrupted, all three systems and subsequent performance suffers. There are numerous internal and external factors that can affect these physiologic functions. Exposure to various environments and the use of ergogenic aids represent two of the largest effectors of physiologic function. The altitude, humidity level, and temperature, which is a thermal stressor, represent the environmental factors. Blood transfusion, EPO injections, warm-ups, and breathing hyperoxic gas make up the major ergogenic aids. The aim of this presentation is to explore the relationship between these factors, both environmental and ergogenic, and the resulting positive or negative effects that they have on physiologic functions both during exercise and while at rest. I will also discuss the similarities between the effects had on exercise and those while at rest. Altitude, temperature, and humidity all affect physiologic function during exertion on a continuum. Performance is best at or near sea level and diminishes as altitude is gained. As altitude is gained, the density of the oxygen molecules in the ambient air decreases proportionately to the decrease in barometric pressure. This mechanism results in diminishing levels of oxygen uptake in the lungs as altitude is gained, which then results in lower oxygen concentration within the blood and ultimately lower levels of oxygen being delivered to the body's muscle tissue for aerobic energy production. Humidity's effect on function is dependent on weather temperatures, as high humidity impedes performance in the heat, while low humidity does the same in colder temperatures. The evaporation of sweat provides the body's primary method of expelling excess heat and lowering internal body temperatures, thermal regulation, during exertion in the heat. High humidity levels impede sweat evaporation and internal body temperatures consequently remain elevated until exertion is reduced. Conversely, exertion in low humidity, cold weather contributes to added fluid loss and dehydration risk. Cold air is warmed and humidified as it is inhaled. Expelled breaths are fully humidified, thus creating a net loss of moisture during respiration. Ergogenic aids can also be used to enhance physiologic function. Hyperoxic gases breathed during exertion, blood transfusions, and EPO injections utilize the same pathway to enhance performance via aiming to increase the blood's oxygen carrying capacity. Blood transfusions consist of reintroducing blood into the body that has been previously withdrawn and stored, or via the use of donor blood. This is done at 1 to 3 weeks pre-competition in order to assure the highest oxygen carrying capacity during competition. EPO injections work by stimulating marrow's red blood cell production. Breathing hyperoxic gas allows a greater amount of oxygen to be absorbed with each breath compared to ambient air. However achieved, greater blood oxygen concentration leads to greater aerobic energy production potential and therefore increases performance. Warm-ups are listed as non-factors due to the inability to truly determine their contribution to performance. Top athletes' belief in the effectiveness of warm-ups make it nearly impossible to design an experiment with individuals to factually resolve whether or not warm-ups actually improve subsequent performance and reduce injury potential. However, Catch, McCardell, and Catch state that there are many mechanisms in place that demonstrate the potential benefit to warming up. These include warmed muscles, increased speed of contraction and relaxation, a greater economy of movement, facilitated oxygen utilization and nerve transmission, and increased blood flow through active tissues. Given these mechanisms for potential improvement, the lack of risk involved, and the potential psychological benefit, warm-ups could be listed as a performance enhancer. Factors affecting physiologic function during exertion will have similar, yet sometimes lessened effects while at rest. High altitude can greatly disrupt functions within the body even at rest. At rest, exposure to high altitude results in increases in heart rate and the rate and depth of breathing, as well as slowing down of the non-essential functions such as digestion. In response, EPO is synthesized in the kidneys in order to stimulate the increase in production of red blood cells in order to increase the blood's oxygen carrying capacity. This is part of the process of acclimatization. The body also fights thermal stresses in the same way during rest as it does during exertion. When exposed to heat, the body thermoregulates via radiation, convection, conduction, and evaporation of sweat, with the evaporation providing the major physiological defense against heat. In response to cold temperatures, the body utilizes different physiologic functions in order to contain and/or generate body heat as a means of thermoregulation. These methods include vasoconstriction at the peripheries, increased muscular activity via shivering, and increases in the release of the hormones thyroxine, epinephrine, and norepinephrine. Vasoconstriction at the extremities works to limit heat loss by concentrating the bulk of the body's blood within its warmer core. Shivering creates body heat as a byproduct of the muscular exertion. These physiological responses to heat and cold exposure occur whether at rest or during exertion. The 4 lines on this graph represent muscle temperatures at 3 different depths of the muscle and esophageal temperature while at rest, during exertion, and during post-exercise recovery. The first vertical dotted line marks the beginning of exercise, and the second marks the completion. This graph visually demonstrates the increase in heat production during exercise, with all measures increasing immediately upon the initiation of exercise and remaining elevated for over an hour afterwards. Interestingly, Catch, McCardell, and Catch state that the heat generated by active muscles can increase core temperatures to fever levels that would incapacitate a person if they were caused by external heat stress alone. Core temperatures increase in proportion to the level of exertion and can exceed 105 degrees. Catch, McCardell, and Catch go on to suggest that this increase in core temperature may create a more favorable metabolic and physiologic environment within the body.
Read it again.